طيب، بسم الله الرحمن الرحيم. احنا النهاردة هنتكلم على حاجة اسمها الكويشنير فاليديشن. احنا كنا ادينا كده ايه هنت عنه المرة اللي فاتت. انا بس النهاردة ممكن معانا ناس ما حضروش معانا قبل كده. so I'm going to note بس في الشات. انا هنقول please raise your hand if not comfortable with Arabic. لأن يمكن يكون في ناس عندنا، يعني ممكن يكون في ناس آم، آه، تبقى مش تكون عندها مشكلة مع العربي. ساعتها أنا I will need to hear from them. كنت هبقى حابة أعرف لو هم موجودين. Anyway، طيب questionnaire validation. احنا بنعمل questionnaires ليه؟ آه، او لما بنقول questionnaire validation احنا بنقصد ايه؟ يعني في السيشن دي احنا اتفقنا المرة اللي فاتت ان احنا ممكن نعمل questionnaire من جروب من الأسئلة، كل سؤال فيهم ليه غرض في حد ذاته، وان مفيش علاقة معينة ما بين الأسئلة دي وبعضها. لكن كمان قلنا ان questionnaires ممكن نسميها instruments. امتى نسميها instruments؟ questionnaires دي ممكن تكون بتقيس لنا شيء ما، يعني هي في حد ذاتها تكون diagnostic tool، او مش لازم حتى تبقى diagnostic tool تكون بتقيس شيء. يعني مثلا ممكن تكون بتقيس quality of life، ممكن تكون بتقيس مدى رضا حد عن شيء معين. مشهورة قوي قوي حاجة اسمها knowledge attitude and practice towards anything. مثلا towards استعمال مثلا شيء معين، مثلا من براند من أي حاجة، يعني knowledge attitude and practice towards مثلا ال behavior بتاعنا towards الانسكتيسايدز وخطرها، اي حاجه. اوكي، ده فاذا الكويشنير ده ممكن يكون بيقيس شيء. طيب لو الكويشنير ده بيقيس شيء يبقى زيه زي جهاز الضغط بالظبط. فالسيشن دي احنا مش هنتكلم how to construct the questionnaire، لا احنا هنتكلم لو انا اوريدي عملت كونستراكشن للكويشنير. ما هو كويشنير دوت ان شورت ممكن بقى يتكون من اسئله، ممكن يبقى الانسرز بتاعتها كواليتيتيف، كلام بسأل how أو what أو why، أو ممكن أكون بسأل عن حاجات how often I do it. برضو قبل ما أبدأ محتاجة أنوه عن حاجة اسمها الليكرت سكيل، معرفش سمعتوا عنه ولا لأ. مين سمع عن الليكرت سكيل؟ او مين ما سمعش عن مين سمع الكلمة دي، عن سمع عن الليكرت سكيل؟ مين سمع عن الليكرت سكيل؟ محدش سمع عن الليكرت سكيل. الليكرت سكيل دوت بيبقى اوردينال سكيل. بيبقى السؤال بيسألني عن حاجة ممكن يبقى لها درجات، يعني تلاقيه مثلا الإجابة تبقى إيه؟ تبقى ممكن تبقى never، تبقى مثلا rarely، infrequently، often، always. يبقى أنا كده إيه؟ عندي الإجابة في درجات. فالليكرت سكيل ده ممكن الإجابات دي تبقى 3 إجابات، ممكن تبقى 4 إجابات، ممكن تبقى 5 إجابات، ممكن تبقى 7 إجابات. يفضل دايما إنها تبقى رقم فردي، علشان اللي في النص ده بيبقى تقريبا محايد. وطبعا ايه بيبقى فيه حاجة اكتر منه، اعلى منه، حاجة اقل منه، فده اسمه الليكرت سكيل. فإذا questions اللي موجود فيها الكويشنير ممكن تكون بتسأل حاجات إجاباتها qualitative، ممكن تكون بتسأل حاجات إجاباتها ordinal زي الليكرت سكيل. أي نوع بقى من الأسئلة، المهم في الآخر الكويشنير ساعات يبقى في حد ذاته هو tool أو instrument of measurement. فاحنا هنا او الغرض من السيشن دي هو انا هعمل ازاي فاليديشن للانسترومنت ديت علشان اقدر استعملها، سواء زي ما انتوا شايفين الانسترومنت دي انا مستعملاها في الاستادي بتاعتي دي لاول مره، او انا الكويشنير بتاعي ده انا اخترعته وناس تانية هتستعمله بعدي. تمام. طيب، في بقى المثال من الحياة دي. كانت انا ليه جايبة المثال ده؟ علشان الكويشنير دوت احنا كنا عملناه بالفعل زي ما انتم شايفين. experience of KMC ده اسمه مستشفى، يبقى experience of KMC in managing patients on Hajj caravan a cross-sectional study. طيب دي كانت ايه بقى؟ الاستادي ديت كانت المستشفى دي مستشفى كبيرة في مكة، وبتطلع ناس عيانين يحجوا، وبيسموه الحاج كرفان. فتم اختراع او تأليف هذا الكويشنير علشان يقيس اسبيكتس كتيرة جدا في البرفورمانس بتاع الحاج كرفان دوت. اوكي، فالكويشنير ده ما كانش موجود قبل كده، احنا اللي ألفناه. قعدنا كده ألفناه. كويشنير كان قليل؟ لا، كويشنير كان مكون من 40 سؤال. طيب، من المفترض جدا ان كان في كذا اسبكت للكويشنير دوت، بيقيس كذا حاجه. ممكن يكون بيقيس حاجات عن السيفتي، ممكن يكون بيقيس حاجات عن مدى الرضا، ممكن يكون بيقيس حاجات عن السهوله، عن وضوح المعلومات، عن وضوح الانستراكشنز. يعني اسبكتس كتير من الكويشنير. طب ليه او ازاي نقول ان الكويشنير دوت بيدينا نتائج صحيحة؟ احنا قعدنا اخترعناه، احنا قعدنا ألفناه. مين اللي قال ان الكويشنير ده فعلا بيقيس الحاجة اللي احنا بنقيسها؟ علشان كده احنا هنتكلم النهاردة عن حاجة اسمها validity and reliability of questionnaires as instruments. ويعني ايه validity ويعني ايه reliability؟ حد فاكر او يقدر يقول الفرق ما بين الاتنين، ال validity وال reliability؟ حد عنده اي فكرة عن ده؟ English please. Okay, okay. Yes, I will talk in English. Okay, thank you very much. So now, so in this session, we are talking about questionnaires as measurement instruments. We're using questionnaires to measure something, like, for example, measuring the quality of life, assessing for diagnosis of certain psychiatric diseases like depression. If you want to assess knowledge, attitude, and practice of people towards a certain phenomenon, so you are using your questionnaire for measurement. Within this context, you need to define, or you need to ensure two aspects in the questionnaire: validity and reliability. Any idea about what it means, validity and reliability, and the difference between them? Any idea? Any suggestions? Validity. What does validity mean? Any idea? Validity means that what you are using is measuring what you are intending to use. So, if you're talking about validity of a quality of life questionnaire, is this questionnaire really measuring the quality of life? I mean, if this questionnaire gives you a number, a total score, does this total score reflect something about the quality of life? So this is what we call validity. So validity means that this instrument is actually measuring what it should measure. It is related to the type of questions that you are using. Are these questions really relevant to your topic? So this is the word validity. What about reliability? What about reliability? Any idea? Reliability, on the other hand, it points to the consistency of results or the consistency of measurements. Like if a questionnaire is assessing, again, the quality of life or the severity of depression or the degree of satisfaction, does this mean that when the score is increased, does it mean that all the questions in the questionnaire are converging towards this phenomenon? If all the questions are converging towards this phenomenon, it will mean that if I get a higher score, it means higher satisfaction. If I get a lower score, it means lower satisfaction. The two phenomena, validity and reliability, are very much related, yet they are a little bit different. So as you can see, this is a very famous diagram. The circle on the very left side, okay, this is showing something that's reliable because all the dots are related to each other. When you are measuring, let's say on the same people, or you do repeated measures or repeated measurements, you seem to get related readings. However, you are totally off the target. So this is not valid. Although it's reliable, but it's not valid, so it's good for nothing. It's not even measuring what it's intending to measure. This is another instrument which seems to be valid because the points are dispersed equidistantly from our center, but it's not reliable. Sometimes it gives me a measurement which is high, sometimes low. So this has very low reliability. This is neither valid nor reliable because it is aiming one half of the circle, so it's not centered, or it doesn't have a constant relation to the center or to the target, and it's not even reliable because the points are dispersed all around. This is something which is valid and reliable. If we're going to apply this to a questionnaire, it means that the questionnaire is giving me points that are not variable, and at the same time, they are reflecting the truth. So there is low variability of the results, and it also reflects the truth in my study population or in my study sample. So we are going to discuss both in details: validity, assessment of validity, and reliability. We are going to start with validity. So as we've said, validity refers to the fact that a tool, the tool here is the questionnaire. We call it the tool, we call it the instrument, because here we are using a questionnaire to measure something, a set of questions. Maybe they're 10, 20, 30, 40, whatever number, maybe a set of 3 questions that they are trying to measure something. They are trying to measure whether someone is depressed, whether someone is satisfied. So it's a tool. A tool measures exactly what it poses to measure, or what it proposes to measure. So if you are measuring satisfaction, your questions are centered on satisfaction. They really reflect patient satisfaction in a certain aspect. Validity is not an instrument characteristic, but rather refers to a defined population. So you are, when you are assessing validity, it's not just about the instrument. It's about validity of this instrument related to this population. Okay, so validity and reliability, they are not totally independent. An instrument which is not reliable cannot be valid. Okay. However, a reliable instrument which gives you more or less consistent results may not be valid, as you've seen in the diagram. Starting to talk about validity, we're going to talk about 3 aspects of validity: something called content validity, criterion validity, and construct validity. Again, we are talking mainly about questionnaires. So we have content, criterion, and construct validity. Content, criterion, and contrast validity. But we're starting with something else called phase validity, because phase validity is very famous. We very frequently hear this term for questionnaires: phase validity. Phase validity is a very, it's the most superficial way of assessing validity of a questionnaire. It simply means that a lay person, or even an expert in the field, whoever you are going to consult to get you help with validation, when they read your questionnaire, they can know what this questionnaire is talking about. Like if I give my caravan questionnaire to a patient in the hospital, okay, they're going to read it and they're going to say, okay, you are trying to measure satisfaction about the caravan. If I give the set of questions about measuring depression to a psychiatrist, he's going to read the questions and tell me right away, okay, it looks like you are trying to assess depression or the degree of depression, or to diagnose depression or diagnose another psychiatric disease. So phase validity is the very simple direct, short way of just telling us whether this questionnaire or this instrument seems to be measuring what it is intended to measure. Okay? Okay. Now we move to content validity. So content validity refers to the degree in which the instrument content reflects the construct. Now, what's the construct? For example, if you are measuring, setting a questionnaire to measure satisfaction at work, you need to address in your content in this questionnaire, you need to address all aspects of work satisfaction. So you need to address aspects about promotion, about salary, about environment of work. Within each one of these domains, again, you need to ask about all aspects or sub-aspects within that domain. So this is the validity of the content of the questionnaire itself. And there is no statistical test to judge this. However, to try to quantify the content validity of a questionnaire, we might do something called the content validity index. And I'm going to show you how it works. I'm sorry that this is in Arabic, but I'm going to translate this. This is trying to assess the content validity of a questionnaire. So we have here each question. So this is a question talking about the area of residence. And then this is the standard of education. And standard of education of the father, standard of education of the mother, then the age of the father, then the age of the mother. With each or in front of each question, there is some rating that is required. When we design the questionnaire, we give this questionnaire to a number of experts, to peers. Let's say we give this questionnaire to 3 experts and we tell them to read the questionnaire. And here's a better example. We can give them a matrix like this one. This is again about the questionnaire from the Hajj Caravan. This is the first question. It says, information about Hajj Caravan was given to me early enough before my visit to Arafat. So here I'm asking the expert to comment about this question. We require rating here. Is this question very appropriate to my topic? Is this question good? Is it fair? Is it not appropriate? So here, the expert, whoever is trying to validate the questionnaire with me or to help me with validation, is going to put a comment about this question and about each other question. They are going to read each question and say whether it's very appropriate, it is good, it is fair, it is not appropriate at all. And they are going to do this for all the questions. Even they are 40, 50 questions, they are going to judge each question, whether it is suitable or not suitable. They give each question a grade out of or ranging from 1 to 4. Now, as I said, of course, I am giving them the chance to write comments here. Maybe to write comments to rephrase, to modify that question, to make it more clear, whatever. At the end of the day, I am going to consider the questions that have taken 3 or 4 out of 4, because these questions, or for each question, this is what counts. The question needs to be very appropriate or at least good. So I'm going to divide the number of answers or the number of experts that gave this question 3 or 4 by the total number of experts who validated this questionnaire. Let's say I gave this questionnaire to 5 people. 2 people gave this question, this particular question, 3 or 4. So it's going to be, okay, 2 out of 5 people, which means that this question took 0.4 as a score. This is not good. This question may be kicked out. At least 4 out of The 5 people should say, okay, this question, okay, is good enough to stay in my questionnaire, or else for them to modify, to request modifying it. So the content validity index, it measures the proportion or percentage of judges who agree on certain aspects of a tool and its items. This method consists of 4-point Likert scale. Again, Likert scale appears here because it's a graded, it's an ordinal scale. A scale for 1, non-equivalent or not relevant. 2, the item needs to be extensively revised. They might write a comment for us. So equivalence can be assessed equivalent item or needing minor adjustment or totally appropriate item. Okay, so any items that receive 1 or 2 points, they have to be revised or removed. They need all to be appropriate. And we might also calculate a content validity index for each question. So any question about validity or how to check validity? Content validity. Content validity. So content validity is basically the content of your questionnaire. Is the content of your questionnaire appropriate or not? There is no statistical way of doing this. This is done by giving your questionnaire to a set of experts. The more, the better. Those experts, they are going to comment on each and every item in your questionnaire. They are going to give it, okay, a grade which ranges from 1 to 4. And then you are going to see how well each question did on the questionnaire, and you might be asked to remove some of these questions or to modify them. So this is the content validity. And then there is the criterion validity. Criterion validity is the relation between a score and an external criterion. Those who attended with us the diagnostic studies session, we talked, remember, there was a study that assessed a single question given to a patient, telling that patient, are you depressed? Now, to check criterion validity of this question, we're going to refer this or going to compare it to a gold standard. Maybe a whole set or a complete questionnaire trying to assess depression. So in which case we consider the criterion has to be a widely accepted measure with the same characteristic of the assessment tool. An instrument or criterion is considered the gold standard. The gold standard here, it means the test or the questionnaire which is totally acceptable by all the experts. I am checking whether my new test or my new question or my new questionnaire is giving me the same result as the gold standard. We call this criterion validity. Okay. This is going to be a bit too deep. Now there will be some aspects here of validation that are too complicated, and I just need you to know the names. You won't be able to know the details of all aspects of validation. So we talked about content validity. I think this was very much straightforward. Then we said a word about criterion validity. It's when you compare your instrument to a gold standard. And then there is the construct validity. Construct from its name, you are trying to see whether your instrument is reflecting the relation between different variables. I'm going to show you something like this. This is a study that assesses physical activity and functional limitation in older adults and the influence of something called self-efficacy and functional performance. Never mind the difficult words. This study is trying to predict or this research is trying to study what affects, for example, the walking behavior of older people. What affects the walking behavior of older people? What factors are involved in the walking behavior? Because walking behavior is a form of physical activity. Okay, so if we are going to enhance physical activity of older people and we need to enhance their physical activity, we need to know the factors that affect this physical activity. So they used a set of questionnaires, not just one questionnaire, a set of questionnaires, or a big questionnaire consisting of different sections. Now, one of these sections, it was assessing something called wayfinding self-efficacy, whether how effective or how efficacious they were in finding their way around, and the functional lower body functional performance, how their lower body, how their muscles, how their lower limbs functioned. Okay, and whether or not they had functional limitations in their lower body. So they measured this, they measured this, and they measured this. And by a complex way of statistics, they started relating them to each other and building this diagram. This is called structural equation modeling. They are trying to build a whole construct. They are trying to construct something. Just by the questionnaires, they are measuring different aspects, and they are trying by regression analysis or by complex statistical analysis to find the relation between each of these factors and each of these aspects, let's say, of a questionnaire, or aspects that measure different aspects in that older person's life. And at the end, they come up with this, with a diagram like this. This is when they assess. When we do that, we assess. If we're going to use this method, okay, we call it a construct. Okay, we do that, but what we call structural equation modeling. And when we assess the validity of this, we assess what we call the construct validity. Okay. So this is about structural equation. These are details. Okay, cross-cultural validity. Again, when you are doing a questionnaire, let's say you invented a questionnaire and you tested this questionnaire in a certain population, and it proves that this questionnaire is valid. It has good face validity, good content validity. All the questions are relevant. You come up with a good questionnaire, and as you're going to see later on, it has good reliability, as I'm going to explain. This doesn't mean that the same questionnaire is going to be valid and reliable in a different population, because this different population is a different culture. And for the very, very simple example, we may have different dialects. The same word may mean something in a population and mean something else in another population. That's why we don't just translate questionnaires. We need to translate questionnaires and assess their validity and reliability when we are using them in a different population. This is called cross-cultural validity. The simplest way of validating questionnaires when you are translating them, when you are using questionnaires in different population, talking a different language, is to translate and back translate. So if I'm going to use a questionnaire designed in English and I want to use it in Egypt, in Arabic, I will translate the questionnaire from English to Arabic. Okay? But then I get a different person, totally independent person, who's going to back translate the questionnaire from Arabic back to English. And then I'm going to compare the original questionnaire with the back translated one. And they should be almost similar. Or else it means that during the translation, things, as they say, were lost in translation. They were not translated in the correct way and then back to the original language where we started. So we talked about content validity, criterion validity. We compare with the gold standard. These are a bit of details. Maybe in some other sessions, we deal with the special situations of criterion validity, something called concurrent validity and something called predictive validity. I can say a word about that. If you are assessing an instrument or a questionnaire against a gold standard and you are getting both results now, okay, if it's for, let's say, diagnosis and you get both results now, you are using both instruments at the same time. This is called concurrent validity. You are doing concurrent criterion validation. However, if you are, let's say, using a method to predict something that is going to occur in the future, and that something that's going to occur in the future is considered as your gold standard. Like, for example, whether I'm trying to predict whether a patient is going to live or to die. Okay, so life and death here is the robust outcome I have. We consider that as not really as a gold standard, but as the point of comparison. If we are waiting for that to happen in the future, we call this predictive criterion validity. So we talked also about construct validity. Okay. The rest of things are, and we talked about cross-cultural validity. Now we talk about reliability. So what does it mean, reliability? Reliability is the ability to produce consistent result in time and space and observers. So let's say, for example, if you are going to use a questionnaire on a set of people, and then you are going to use the same questionnaire on the same set of people after, let's say, 1 week or 2 weeks, you should get consistent results. So this is consistency in time. If you are going to use the same questionnaire, okay, on different people, but with the same variation of response, like, for example, they have, let's say you're going to reuse the questionnaire on another set of depressed people. Okay, this is again about reliability of questionnaire. Now, if it's not a questionnaire, if it's something that you use for diagnosis, or if the questionnaire is administered by 2 people, because it's the way you administer the questionnaire that also affects the results. The way I say the question. Sometimes we need training, okay, to administer the questionnaire. So if you want to be sure about the inter-rater or the inter-person, okay, reliability, you may use the same questionnaire by 2 researchers. 2 different researchers, they administer the same questionnaire to the same people, but here the researchers are different. You should be able to get consistent results. So this is so reliability is when you get consistent results, whether in time or whether in space or whether by different raters. Okay, now again, we talked about validity, we talked about content validity, about criterion validity, about construct validity, about cross-cultural validation. In reliability, we need to talk about something called stability, internal consistency, and equivalence of a measure. Okay, so again, we're going to talk about 3 things. So again, reliability, even more than validity, is not a fixed property of the questionnaire. It relies on the function of the questionnaire, on the population on which the questionnaire is used. So if you change the population, reliability might be also changed. So if you are, for example, a very practical example, if you are using a questionnaire, by the way, if the time ends, we're going to enter on the same link. We can use the same link again. So for example, if you decide to use a questionnaire about quality of life that was administered, let's say, in Europe, in a certain country or in a certain population, and now you are using that questionnaire in a different population, you need to assess the reliability first. And reliability, by the way, is assessed in a very simple way statistically that I'm going to show to you. Okay. So reliability depends on the circumstances, on the context where you're administering the questionnaire. Okay. So under different conditions, the same instrument might not have the same reliability. Okay. Again, raters affect reliability, people administering the questionnaire, sample characteristics, the population, okay? The type of instrument administration method, maybe if you give people to answer on their own, you get a certain level of reliability, but if you are going to tell them the questions and take the answers, this is another way of administering the questionnaire, you might get different reliabilities. Okay. So again, we're going to talk about three aspects of reliability: the stability, internal consistency, and equivalence. So what is stability? Okay. So stability, it's how similar the results are when measured at two different times, or the consistency of a measurement. This is typically what we call test-retest method. It is like the example I talked to you about. Let's say I'm designing a questionnaire. I'm going to give it to a population, to a sample from a population. I get my results. And then after some time, I'm going to re-administer the questionnaire and see whether the results are similar. So I'm using the same questionnaire on the same people, or let's say the same instrument, because it might not be a questionnaire. Let's say it might be even a lab measurement. It might be anything that I'm measuring. But the important point here, okay, about the word stability is that I am using the same method of measurement on the same people, but at two different times. This we measure it by something statistical called intra-class correlation coefficient. So it's measured by something called intra-class correlation coefficient. Okay, so this is the correct test to judge about stability. Those who are aware about statistics, they might have heard about something called Pearson or Spearman correlation. So what is correlation? This is a reminder.